Bile is a yellow-green fluid that is produced in the liver and stored in the gallbladder and works very closely with the digestion process. Bile emulsifies fats so they can be easily digested and absorbed, thus enabling the liver to excrete waste products. Because most individuals are more aware of the other components involved in digestion, the function of bile is frequently not appreciated until an issue develops. Many symptoms can be associated with low levels of bile, very different and sometimes even confusing. It also affects digestion along with the general health of a person. It needs to be understood that an absence of bile goes much further than the issue of fat digestion. Rather, it's about nutrient absorption, maintenance of hormone balance, and detoxification processes within the body. Where there is not enough bile for digestion, poor absorption of fats and fat-soluble vitamins including A, D, E, and K sets in, leading to deficiencies that may show up as dry skin, weak bones, and even problems with cognition. Also, inability to have sufficient bile will facilitate toxin buildup as it helps in removing wastes from the body. In this video, we'll explore the strange and surprising signs of bile deficiency, revealing how this often overlooked substance can significantly impact multiple aspects of health when its levels are out of balance. But before we move on, quick reminder. The information in this video is for educational purposes only and should not replace professional medical advice, diagnosis, or treatment. Now let's continue. One symptom of bile insufficiency that is considered relatively well known involves impairment to digestion, more particularly of dietary fats. When the bile levels are insufficient in the body, the absorption of fats becomes impaired and might lead to symptoms such as greasy or floating stools. The greasy or floating stools may also be somewhat hard to flush. This may be a symptom of poor absorption of fats because they stay undigested while being passed in the stool, due to the fact that intestines are not able to handle such conditions. People with chronic bile deficiency feel bloated and indigested after food, especially after more fat-containing ones. Another symptom is constipation or infrequent bowel movement, and this is a result of a lack of bile. Normally, bile oils the intestines to regularize the bowel movement frequency and allow regularity. If there is not enough, then passing feces can be painful and hard. This is why there is infrequent passing. Moreover, undigested fats in the intestines cause more gas and discomfort because they ferment and create gas in the intestines. These gastrointestinal disturbances relate not only to comfort, but also represent a cue about impairment of fat digestion and nutrient absorption, again underlining the importance of appropriate production of bile. Bile is very important in the absorption of fat-soluble vitamins like vitamins A, D, E, and K, all these having critical functions maintaining the integrity of the body. When the level of bile goes low, there is poor absorption of such critical vitamins by the body, thus leading to deficiency diseases characterized by critical symptoms. For instance, the absence of vitamin A will result in night blindness or poor vision in the dark, while the absence of vitamin K will make bruising easy since it disturbs the blood coagulation process. These symptoms are usually pretty nonspecific and could actually be mistaken for other conditions. Hence, even the bile salts deficiencies should be ruled out. Vitamin D, which is most frequently associated with a shortage of bile, can lead to the thinning of bones and an increased risk of bone fracture because, without the appropriate, normal quantity of bile within the body, the system cannot adequately absorb vitamin D, a nutrient that is essential to absorb calcium to maintain healthy bones. A deficiency in vitamin E, another fat-soluble vitamin, might also lead to neurological disorders. Since this vitamin plays the significant role of protecting the neurons from damage, people with a deficiency in bile also suffer from unexplained fatigues. It becomes hard for the body to extract all the needed nutrients from the fat. Hence, energy is further depressed. Such deficiencies outline the importance of bile in sustaining health and how its deficiency can have very far-reaching repercussions rather than being confined to the simple digestive problem. The skin and hair are most often the first external signs of nutrient deficiencies, and a lack of bile is no exception. With insufficient bile, essential fatty acids and fat-soluble vitamins can't be readily absorbed into the body, which may lead to symptoms such as dry, flaky skin and various rashes. Vitamin A is in charge of skin health, and the lack of it results in rough and bumpy skin. Examples include keratosis pilaris, small, hard bumps on the skin. The deficiency in vitamin E protects skin cells from damage caused by oxidation. It will result in dry skin and a dull complexion. A lack of this bile will also lead to compromised hair health because, like nails, hair requires a constant supply of nutrients to be strong and healthy. Without bile, thinning strands may occur, or one may experience complete hair loss, since the body cannot correctly absorb the essential fatty acids and fat-soluble vitamins necessary in hair growth and maintenance. In more critical cases of bile deficiency, it also takes on a yellow skin tone, known as jaundice, which indicates complications of the gallbladder and the liver. The skin and hair symptoms not only reflect one's appearance, but also carry important messages of deeper health conditions in times of bile insufficiency. Thus, prioritizing their recognition and addressing them should be considered paramount. Coloration of urine and feces can provide considerable information about various indicators of health, and low levels of bile might cause specific changes in these areas. For example, it is normally the bile pigments that give feces its normal brown color. When the amount of bile coming out of the liver is low, feces may appear pale, clay-colored, or even white. This can suggest that the intestines are not getting enough bile. Lack of color may be the first sign related to the shortage of bile or problems with the liver and gallbladder. Apart from changing the color of the stool, bile deficiency can also change the color of the urine. When the liver has a hard time producing or releasing bile, this sometimes results in darker than usual urine that could indicate a problem with the flow of bile and liver health. Dark-colored urine could mean that the body is trying to get rid of bilirubin, a byproduct of bile, via the kidneys instead of through the intestines. Whereas these are usually dismissed, color variants in urine and stool are key indicators of potential complications associated with bile and, hence, demand a closer look at gastrointestinal and hepatic health. Bile is very important in metabolism, right from the breaking down of hormones such as estrogen down to excretion. In turn, if the body produces fewer amounts of this bile, it may not be able to excrete these excess hormones, thus precipitating various types of hormonal imbalances. For example, an inadequacy of bile can lead to estrogen dominance characterized by mood swings, weight gain, and bloating. Estrogen dominance given for when the body contains too much in relation to any other hormone. Excess estrogen is helped to metabolize and be taken away by the bile. This will also cause hormonal imbalances in women, which manifest in increased PMS symptoms, such as tenderness in the breasts, irritability, and headaches. Even the cycle might get affected because of the hormonal ups and downs that come with the impairment in the production of bile. Even males can be affected by the deficiency of bile, presenting symptoms like fatigue and reduced libido due to an imbalance of hormones. These symptoms, due to hormonal imbalance, outline the interaction of bile within the body with various other functions, making its deficiency a contributor to several health problems other than in digestive function. Since the brain is always in need of nutrition to function properly, it follows that one indirectly influences mental health and cognitive function by the inability to absorb essential fatty acids and fat-soluble vitamins in case of a shortage of bile. Nutritional deficiencies may appear that could impact the brain. Examples include that the deficiency of vitamin D is associated with mood disorders, depression, and anxiety. Similarly, the deficiency of omega-3 fatty acids results in cognitive decline, concentration problems, and poor memory. Brain fog symptoms may include an inability to focus, forgetfulness, and a general feeling of mental tiredness in people with a bile deficiency. Cognitive impairments are increased as the body has inadequate production of bile, and thus has a buildup of toxins. Bile helps the body excrete fat-soluble toxins. Without enough bile, the fat-soluble toxins may build up and interfere with brain activity. Besides this, a no bile condition leads to hormonal imbalance, which can further contribute directly to mood swings and emotional instability. Thus, this may be another major influence of bile on mental health. Such symptoms point out the importance of bile regarding the preservation of mental health from a cognitive emotional angle. A diagnosis of a bile deficiency is a compilation of tests put together with clinical assessments over liver function, production of bile, and digestion. Quite often, this commences with a test of the stool that will say whether or not one is digesting fats appropriately and absorbs them. Undigested fat in the stool may denote bile inadequacy and must be further investigated. Liver function tests, which measure enzymes and bilirubin levels in the blood, can also provide insights into bile production and liver health. Some patients will receive imaging studies of the gallbladder and intrahepatic ducts, either by ultrasound or a hepatobiliary immunodeacetic acid scan. The physician will look for blockages or structural problems that may impede the flow of bile from either of these. It is important that the medical professional makes an accurate diagnosis because he or she is the only professional qualified to order and interpret tests and advise treatment options that may be indicated for specific health conditions. Early diagnosis of bile deficiency helps avoid complications and promotes good digestion and overall health in the future. Prevention from deficiency in bile involves the adoption of lifestyle habits and practices friendly to the liver and gallbladder. In other words, a diet that is liver-friendly, rich in bitter greens and cruciferous vegetables, besides hydrating foods, enhances the production of bile and thus cuts down its deficiency. Similarly, avoid processed foods and deleterious fats such as trans fat and fried foods. These put additional burdens on the liver to produce more bile. Besides, regular medical tests and checkups include the condition of the liver and gallbladder and may diagnose further problems earlier. Preclusion also involves the maintenance of an active lifestyle, as physical activity propels digestion and enhances the production of bile. Correspondingly, one should not time meals excessively or take huge portions of food, for this could eventually lead to an overload within the digestive system that might diminish the potency of bile. The manifestation of such preventive measures would enhance one's natural secretion of bile and also diminish the chances of being afflicted with a bile deficiency later in life. A lack of bile in itself could bring on all types of devastating side effects, right from disturbances in digestion to problems relating to hormonal imbalance and problems in cognition. The capability to define symptoms and some root cause places a lot on the individual for ensuring health isn't compromised any further. Encouragement of production through diet, natural remedies, and light lifestyle changes can be done in multiple ways. A supposed deficiency of bile will make a visit to a healthcare professional guide appropriately towards keeping your optimum best with treatment. The more you understand the importance of bile, the better prepared you will be in taking good care of your digestive system, energy, and well-being.